Shalom, shalom, and welcome back to Ema and Me at Home. If this is your first time visiting the channel, welcome. We are so happy to have you. And if you are a returning viewer, thank you so much for coming back. And we pray that you are blessed by the information you are about to hear. You know, in Proverbs 38:1, it says, "Speak up for those who can't speak for themselves." And in today's topic, we will be discussing the importance of advocating for your loved one while in the hospital. So, what is an advocate? An advocate is someone who speaks on behalf of someone who is unable to speak for themselves. And so, what does that look like exactly when dealing with medical personnel? You know, when speaking with medical personnel regarding your loved one, there will be specific questions that are asked, and we will go over some of those right now. One of the first section of questions that will be asked is basic information about your loved one. Things such as personal details, such as name, address, date of birth, and contact information, along with health insurance information. What type of insurance coverage does your loved one have? Is it Medicare, Medicaid? Do they have an HMO or PPO or something else? Also, what is your loved one's emergency contact information? You know, they're going to want you to provide them with any additional phone numbers for other family or friends who may be able to answer any other questions that they may have concerning your loved one. Also, things that will come up will be consent forms. And some of the consent forms that will be presented to you are consent to treatment, which is a form that allows medical staff to provide care. Another form is a consent to release information, and that's giving permission to share medical information with insurance companies. And lastly, there will be a form such as a COA, condition of admission, which is a contract of the patient's obligations for service, including payment. Some additional questions that will be asked are concerning medical information. And you will be asked questions such as, does your loved one have a comprehensive list of all of the medications that they're currently taking, including the dosage that they're taking, the frequency that they take the medicine? Are they taking any over-the-counter drugs or any supplements? Also, are there any allergies or known allergies that your loved one may have to any medications or other substances? In addition to that, are there any written instructions from your loved one's primary care physician? That may be important as well. Now, I know this next section may be a little uncomfortable, but it is definitely one that should be discussed, hopefully prior to any events of going to the hospital, and that's dealing with legal documentation. And some of the legal documentations that one can acquire before potentially having to go to the hospital would be things such as a living will. So, what is a living will? It's a legal document that's acquired in advance that outlines a person's preference for medical care in the situation where they are unable to communicate their wishes. Another one is, what is an advance directive? It's a legal document that is acquired also in advance that allows individuals to specify their preferences for medical treatment in case they become unable to make decisions for themselves due to illness or incapacity. Next is, what is a DNR order, or do not resuscitate? It's a medical order that typically provides healthcare providers, lets them know not to perform cardiopulmonary resuscitation, otherwise known as CPR, if a patient's heart or breathing stops. And this is actually created after discussion with the patient or healthcare proxy or family members. Another legal document is, what is a power of attorney, otherwise known as a POA? It's a legal document that is acquired also in advance that allows one person to act on behalf of another in a legal or financial matters. And then the last one we'll cover is, what is a guardianship? This is a legal process where a court appoints a person or entity to make personal and or financial decisions for someone who cannot manage those decisions themselves. This is done in the event that there's no POA, a living will, or advance directive that's not already in place. And this is actually the case for me and my EMA. I had to actually retain an attorney, go before a judge who granted me guardianship over her affairs, which includes managing her finances, all of her medical treatments, and filing her taxes annually. Once your loved one is taken to a hospital and admitted, there will be various people who you will interact with. These are a few suggestions to consider if you find yourself in this situation. So, these are suggestions for advocating for your loved one while in the hospital. One suggestion is, if possible, try not to leave your loved one unattended. Or if you're able to get a rotational schedule in place with other family members and friends, especially if your loved one is in a situation where they cannot speak at all, they can't answer any questions, they're not even alert to anything that's going on around them. So, if possible, try not to leave them alone or unattended. And I know that can be challenging or difficult with people's work schedules and other things that we have going on. But again, this is just a suggestion. Also, suggestion is to get the names of the doctors, the nurses, the case managers, and any other medical staff who will work with your loved one, and write that information down along with the date and the time. Also, try to be proactive by asking questions and never feel like you're asking too many questions, especially if something doesn't seem right or feel right. I can't stress that enough. And then this is another big suggestion: write down any medications that are being prescribed. In this situation right here, you definitely want to do that and communicate with the medical staff, especially if you are one who ascribes to eating a certain way, if you follow certain dietary regulations or guidelines, if you don't eat pork or shellfish or things of that nature, that will be important to share with the medical staff, because there are medicines that have those type of substances within it. I know for my mother and I's case, we don't eat pork or any shellfish. And prior to her going into the hospital, I didn't know anything about a drug called heparin. And heparin is actually one of those drugs that does have pork in it. I don't know if there are any different types of heparins, but the heparin, I found out that it does have pork in it. So you want to make sure you do your due diligence, again, by asking questions. If they're presenting a drug that you've never heard before, and you know that your loved one ascribes to that type of dietary way, ask the questions. And typically, most hospitals have a pharmacy on site, and they can actually go to the pharmacy and inquire to say, hey, what are the ingredients in this drug? And they can come back and tell you if, in fact, it does have something in it that your loved one shouldn't have within them because they believe a certain way. So make sure you ask the questions about that, and even do your own due diligence to research some of those medications. Another suggestion is to be observant and listen to what is going on and what is being said or done regarding your loved one. Doctors and nurses, they are such a crucial entity to the care of our loved ones, and the patient, which is why it's so important for the person advocating to really pay attention to what's going on. There was a situation where my mother and I had a nurse we hadn't had before, and when she came on, she had an attitude. I don't know what was wrong, if she was having a bad morning, but she just was not the friendliest nurse we had had. And the most nurses typically, they are great at their jobs, and a lot of them go above and beyond to help with your loved one. But sometimes you may run into a few that may either have bias, or may just be having a real bad day, or just have a nasty attitude. And in this particular case, my mother, she was prescribed, or a protocol was put in place for her to have a particular drug at certain times of the day. Once was at 6 a.m. in the morning, and once was at 6 p.m. in the morning. And so, because I was there with her, I was there when they put that protocol in place, which would have been the night shift. So most nurses will work from 7 a.m. to 7 p.m. And then you'll have a rotational change where you'll have the next crew will come in from 7 p.m. to 7 a.m. This particular nurse came on at the 7 a.m. shift. And so I knew my mother had already had that prescription. And when she came on board, during the time she was with us, I noticed she was getting ready to give her that prescription. And I asked her, I said, "Hey, do you mind if you check? Can you check and see if she's already had that?" I believe she's had that already. And again, like I said, some nurses may just have a bad day, and she lashed out at me and she basically said, "I'm the nurse and I know what I'm doing." And I'm saying, "Whoa, whoa, whoa, yes, you are the nurse. However, I just would like it if you could check, because I really do believe she had that." And I wasn't going to let her give her the medicine before she checked. And so once she did check, come to find out, she did already have that medication. And so, her response to me was, "Well, we all make mistakes." And we, granted, we do. However, in a situation like that, that could have, had I not been there, that could have been a situation where something drastic could have happened to my mother. She could have had an adverse effect to it, could have been a permanent situation. We don't know, but that's why, we're there to advocate for our loved ones, because they can't speak up for themselves. And so again, that's going back to asking questions. Don't feel like you're asking too many questions, but be observant. And if you're writing these things down, then you'll know. It's like, "Now wait a minute, I know the doctor said do such and such, but she or he is doing such and such." So that's just something to be mindful of. Also, don't allow any medical staff or hospital staff to pressure you into making any rash or hasty decisions that may cause fear. If you're the person that's going to be advocating for your loved one, it's so good or important if you can have a team of people that works with you. If it's not your family, or if you attend a church or an assembly and you have people there with you that you can discuss these things with, or whoever the case may be, so that you can, you know take your time to think rationally about making decisions, because the decisions you make could very well be bring about a good thing or a negative thing concerning your loved one. So it's good to have a group of people that you can discuss things with, talk with, bounce things off, get people's suggestions and things of that nature. But the most important thing is to pray, which we'll cover that in a minute. If you have a person who will make decisions on behalf of your loved one, make sure that they have or will acquire the proper documentation to prove it, which we already discussed concerning legal documentation. There was a situation with my mother where I didn't at the time have any legal documentation. Um, and there was a situation that happened at the hospital, um, where it was suggested to me to acquire that information, which at a later video I may share that situation with you. But for now, if you can acquire the proper documentation for your loved one, if it's needed, then by all means definitely do that, because it can be and will be very important. And the last thing would be is to pray, pray, and pray. Pray for wisdom, pray for guidance, and pray for understanding, especially if you ascribe to being a believer. I can't stress that enough. Um, I know we have a team of people when my mom has gone in the hospital on various occasions, and the doctor may come back and say, "Oh, this or that, and the third." I will send those text messages out and say, "Hey, can you guys pray?" And if it's something like really over the top, then you may need some spiritual warfare prayer instead of just your traditional, you know, regular prayer. But a lot of times in hospitals, you'll have a lot of spiritual warfare that goes on. And so if you have yourself or a person who's that spiritual or prayer warrior, as you say, in your family or in your group, then by all means definitely solicit that person's prayers or that group's prayers, because prayer definitely works. We have so many testimonies that came about just for us praying and standing on what we believe and not necessarily doing what the doctors say. Because I mean, I had several doctors tell me in my face, well, if you don't let us do this, your mother's going to die. And that was very brash. And as for doctors, doctors, they are very integral people, but typically doctors don't have great bedside manner. They just don't. They're coming in, they're laser focused. They're looking at, okay, we need to do X, Y, and Z, and we need to do it that. And sometimes they can come off as being just very brash in what they say. But that's why, again, it's so important to have a team of people if you're able to, and definitely pray, because sometimes they may say stuff that you don't agree with because of your faith. And like I said, we had actually I had to deal with that on several occasions. So in conclusion, let's recap. In today's topic, we discussed the importance of advocating for your loved one, which is speaking up for those who cannot speak for themselves, according to Proverbs 31:8. We discussed what questions medical personnel will ask concerning your loved one, such as basic information, consent forms, medical information, and any legal documentation. We then discussed the importance of advocating for your loved one while in the hospital and what that may look like. A few of those suggestions were, if possible, try not to leave your loved one unattended and develop a rotational schedule between family and friends. Another suggestion that we covered is don't be afraid to ask questions and try to write down and keep track of the medical staff who works with your loved one. I just want to take this time to say thank you for stopping by, and I hope that the information that has been presented is helpful for at least one person or one family. And as I close, I pray that the Most High will bless you and protect you. May He smile on you and be gracious to you. May He show you His favor and give you His shalom. Until next time, please like, share, subscribe, and even leave a comment. Until then, shalom, shalom.